Telehealth and virtual care visits have rapidly emerged as major players in the healthcare landscape, offering both convenience and flexibility to patients and providers alike. In this video, I would like to go through the pros and the cons of using telehealth and virtual care visits, whether it's bridging the gap between urban and rural areas, to having access to specialists without actually having to make the trip, which is lowering expenses, all the way to privacy concerns and the issue with misdiagnoses. There's a balanced view for everyone here. Doesn't matter if you're a first-time user or a frequent flyer. Continue watching below and you're bound to learn something that's going to provide you with the ability to make an informed and balanced decision on what's best for your situation. Pros for telehealth. Reduced hospital readmission. Telehealth has a role in continuously monitoring chronic conditions. Things like diabetes and your insulin tracker is virtually available to your doctors so that if something were to happen, they immediately know about it. That definitely helps with people reducing the stress of family members having to continuously keep an eye on things. It also gives you the ability to plan your day more appropriately. Having remote follow-up appointments can prevent complications with post-surgery issues. And this makes it easier for the patient to recover because then they don't have to get up and go to the hospital while they're recovering. There's a chance that your immune system's a little weakened after the surgery, and so going to the hospital could put you at risk for other illnesses. Doing a virtual visit from home, you're more comfortable, and the doctor can get a good grasp of how you're actually recovering. Access to specialized care for rare diseases. This makes it easier for consultations with specialists without the need to travel. As I was mentioning previously, traveling when you're not feeling well, we all know that's not fun. You want to be in the comfort of your own home, around family members. You just want to be comfortable. So being able to have a virtual visit consultation with a specialist will help your treatment and your prognosis. It also gives enhanced care for patients with complex conditions, because if you have, say, a rare form of cancer, your oncologist could be in a completely different state, and therefore not having to travel to go on regular checkups with them certainly makes it easier for you to cope with this condition. The environmental benefits. There's a reduced carbon emission due to fewer people having to travel for in-office visits. It's estimated that you can eliminate millions of tons of carbon emissions each year just by taking advantage of telehealth and virtual care visits. And to me, that's a huge thing. Improved rural healthcare access. Addressing healthcare gaps in rural areas has been an ongoing issue for the last couple of decades. But with the emergence of telehealth, this quickly bridges the gap because now you have people in rural areas who have access to the doctors that are more urban centralized, whether the doctor's at a major hospital or in the center of the city, so that has more access to different people coming from different directions. Giving the access for virtual care bridges that gap and makes it a lot easier for people to be willing to go on these visits. Because before, you sometimes had people who would say, I don't feel like traveling 2 hours to the city, 2 hours back from the city. It's just not worth it to me. I'm gonna stay home. And therefore they never get seen and their condition gets far worse. Chronic disease management. Having remote monitoring for conditions like diabetes or hypertension allows your doctors to have immediate real-time access to what's going on inside of your body. And that is a huge thing because the quicker you can spot a problem, the more likely it is the problem does not become a bigger problem. I know for myself, having fibromyalgia, being able to have my doctor monitor my condition remotely, I can check in with her as frequently as possible, and it makes it easier for her to take notes and to prescribe certain medications that I might need. It also makes it easier and more willing for me to communicate with her. And timely interventions for healthcare providers without frequent office visits help speed up their schedule, because they can more rapidly see you. If they're seeing you more frequently, then the visits don't need to be a half hour or an hour long. They could be 10 or 15 minutes, which opens up the ability for the provider to see more patients. And that actually provides more healthcare to people, which makes treating these conditions much easier. Now, cons for telehealth and virtual care visits. Some of these things, I gotta admit, I didn't think of right away, but they are legitimate concerns, like digital literacy barriers. See, people my age, we grew up with computers and we got comfortable with them, but older people, they are sometimes less comfortable with technology, and even less comfortable with being on videos and such for these visits. I know we've all been on Zoom and we felt uncomfortable the first time we were doing it. Imagine being someone that's older, that's even a bigger barrier to get over. And it's also a challenge in engaging in virtual healthcare platforms, because each doctor are they're gonna use different providers, like whether it's Google Meets, Zoom, or anything else. This means that you have to get used to using these types of platforms. And while a younger person might have an easier time getting used to it, an older person is definitely not. There's a risk for misdiagnosis. A lack of a full physical examination in virtual consultations, this increases the ability for the doctor to miss something, and therefore when they're missing a piece of the puzzle, they might come up with a different conclusion, and that can impact your treatment moving forward. Limited access to certain specialized care. Advanced equipment and in-person assessments still require people to travel and go to in-person appointments, especially with things like cardiology or dermatology, where they actually have to physically examine you to get the best results. Their effectiveness through virtual care starts to diminish greatly. Overdependence on technology. Reliance on a stable internet connection and working devices is a big part of virtual care. Lower income families, and especially in more rural areas, they might not have access to these things to make virtual care visits a feasible option. There's also privacy concerns, because people's computers may not be as secure as other people's computers, and therefore it puts them at risk for cyber attacks and hacking. So then they can get into your system and steal your identity and other things like that. And there's also some legal challenges with cross-state telehealth. Some states reciprocate the licenses while others do not. And so this could put a problem ahead for you when deciding which doctor to use. Also, there's an issue with the insurance. Some insurance might not cover doctors outside of your network. And with the marketplace, a lot of these networks are within your county or a tri-county area type situation. So you have to make sure that the doctors that you want to use will be able to be covered through your insurance plan before you go on to these virtual visits, or else you could end up having to pay for the appointment out of pocket. And some of these specialists, those appointments, those consultations could be very, very expensive. So you need to think about that. So in closing, it's important to weigh both the pros and the cons and deciding which is best for you. In doing so, this will provide you with a fact-based decision and not just an emotional one. Everyone's situation is different, so you need to weigh these as it relates specifically to you. I also have always been very much encouraging of people staying informed on different technologies and ways to improve our life. So knowing the pros and cons of telehealth will definitely check that box. Now, as you're weighing the options for telehealth, what do you think are some of the drawbacks? What do you think are some of the upsides for you? And I hope I've been able to answer a lot of questions that people might have had. If you have any further questions, feel free to email me, give me a call. My information will be in the description below. And comment into this video if you would like access to my ultimate estate planning guide. Until next week, I hope you have a wonderful weekend.